Welcome to Beyond the Stethoscope, UCR Health's podcast series on health and wellness. I'm Dr. Naveen Raja, Chief Medical Officer of UCR Health and Professor of Medicine at the University of California, Riverside School of Medicine. UCR Health's physicians and healthcare professionals are dedicated to supporting the health and well-being of the people who live and work in the communities we serve. Join me as we converse with physicians and professionals on achieving optimal health and wellness for you and your families. It is a rite of passage in America. Each fall, millions of children who have just graduated from high school and stepped into adulthood enter college. Most of them leave home for the first time and live on their own. It is their first foray into the large world. For many, it's a lot to take in, a lot to experience. It is also a time of significant stress. As young adults, they're still finding their adult identities. Many may also be facing financial stress and may be juggling a job alongside school. Given the culture and norms of college life, their sleep, food, and exercise routines may be thrown off. And all of these changes are occurring at the same time. It is a lot to take in, process, and cope for anyone, leave alone a newly minted young adult finding their way around in a new world. This much pressure and change sometimes leads to anxiety or depression. In surveys, 17% of college students report feeling depressed, and 9% met the criteria for major depression. 10% screened positive for generalized anxiety disorder. 6% report considering suicide. There are indications that these rates are only increasing. Only a quarter to a third or so of these students receive any treatment. Managing this is difficult for these young students, but also for their families and friends who care about them. I should note that depression and anxiety also affects young adults who are not college students. In today's episode, let's learn more about mental health in young adults. Join me now in a conversation with Dr. Toshia Yamaguchi. Dr. Yamaguchi is an assistant professor of neuroscience at the University of California, Riverside School of Medicine. She specializes in mental health of college students. She's board certified in adult psychiatry as well as child and adolescent psychiatry. She practices at UC Riverside Health. Her philosophy of practice is to consider the biological, psychological, social, and cultural influences on mental health. Dr. Yamaguchi, welcome to our podcast. It's wonderful to have you join us, and we look forward to this conversation about a very interesting topic, very important topic, a topic on mental health, especially in college-aged adults. So prior to this podcast, you and I were talking, and I was thinking, during the course of development of our children into young adults, they grow up and they're influenced by a number of factors, both in the family, in the social environment, in the physical environment, and then they grow older and eventually they go to high school and then college. And as they go through this cycle of life, they encounter a lot of change, right? And during that change, at some point, they may experience difficulties with mental health. How does that develop? What are the factors that affect mental health and what causes their development? Are there genetic factors or there environmental factors? What causes the development of these conditions?
Yeah, I think that's a natural question we ask, especially when it comes to receiving a diagnosis. In a psychiatric clinic, the natural inclination is to ask, why did this happen? And it's a complicated answer. So one of the things that I like to focus on in teaching in the psychiatric clinic to the medical students and the trainees, the residents and fellows, is something we call the biopsychosocial model. And this is something that's been traditionally used in the field of psychiatry to develop case analysis, essentially. That's holistic rather than focusing solely on the psychological or solely on the medical/biological. The idea is to consider the multiple sources of psychopathology, which is the biology, including genes or environmental exposure, such as, in utero exposure to drugs, alcohol, or traumatic head injury. And then there's the psychological factors, such as trauma that happens in childhood, and social factors, such as housing stability, how much connection and support someone has socially. So all of these things start from, like I said, prenatally, right? So these things are affecting individuals and their ability to develop mental illness very early on. And the circumstances of one's life can change drastically, and all of these things have an impact.
So it seems you're saying that almost anything in a person's life has some impact on mental health, positive or negative. And but what about as they get older, as they're going to college? Are there social things that affect their mental health? For example, academic pressure and the pressure of being away from home. Those
Yes,
types of
absolutely.
things, do they affect? And how can you describe a little bit more about how that might affect a person's mental health?
So, for an example, from patients that I see a lot of academic pressure, which can come internally, it can come externally from society, from parents. But I see a lot of that affecting my patient's mental health, to the point where it's hard for them to pull back from taking difficult courses or a heavy course load. I see it putting a strain on their social relationships, their ability to balance school and a social life or their own interests and hobbies. I also see what the other thing you mentioned, which is basically homesickness or even to the point of separation anxiety. That can be all really hard for college students, especially dealing with all at once. Um, I also see social pressures related to dating, substance use, having the right social circles, quote unquote. So, yeah, there's a lot of things that students are dealing with.
It seems like many things are converging on the life of this young adult all at the same time, and perhaps addressing them or coping with them is difficult for someone who's just beginning life. So that seems like one of the factors. So this is a hard one to ask, but what about the role of bullying and cyberbullying that seems to happen in that age group?
So I would say I hear more cyberbullying being an issue in like preteens and teens. And it is a really big issue. It has been associated with self-esteem issues, body image issues, depression, anxiety, suicidal thoughts. So yeah, cyberbullying has been a big issue. And there's a difference between cyberbullying and bullying IRL as well, right? Because cyberbullying is pervasive. It can be constant. It's not like it's just present at school. It can go from school to after school to someone's bedroom because they have access to their phone, the internet constantly.
Yeah, there seems to be no respite from it. You can't get away from it, right?
Yeah.
So, what are some of the things that these young adults and perhaps their families, parents can do sort of in a preventive mode? What can we do to maintain mental health?
I think one of the things that I talk about with families is the idea of building resilience. And this involves setting your child up for success by giving them developmentally appropriate challenges and in a stepwise fashion where it starts easy. And as they get success, as they build their self-esteem with feeling a sense of self-confidence, accomplishment, and self-efficacy, they take on gradually more and more difficult challenges. So it needs to be developmentally appropriate, and it can't be going from no challenges to all the challenges, which sometimes happens when kids go from living with their family to being on their own in college.
You seem to be saying prepare them for what's going to happen, give them smaller challenges so they can prepare themselves.
Yeah, give them a growing sense of independence, and independent decision making so that they can build that capacity to make good decisions.
That's a great point. So now let's say there is a student who in college who's just made the transition from home to college, and they're living there, and they kind of think something is not right with themselves. They don't feel good about themselves, or they don't feel good about where they are, what they're doing. What are the things that tell people this is just change, right? This is just change from where I used to live, what I used to do,
Mhm.
um, or that this is really something that's that's an issue that needs to be addressed, needs to be looked
Yeah.
into by a healthcare professional. So how can one be aware of what's going on and make that decision for themselves that this needs some attention or this is just a change that I'm going through?
Yeah, that's a really good question. It really, what we look at when they come in for an evaluation is whether there's the presence of a cluster of symptoms and whether there is a significant level of impairment in functioning. And that impairment can be at school, it can be at work. Some of these students are working part-time jobs or even full-time jobs, some of them. Um, Whether it's impairment at home with their spouse or their roommates, whether it's impairment socially with their family members, their friends. Um, so seeing those sort of patterns emerge and those difficulties emerge, that's when we want to take action and change something about that individual's way of handling it, whether that's through support via therapy, um, which could be, individual group therapy, individual or group therapy, or support medically with medications.
So the thing that tells you that you need attention seems to be that something's wrong, not just in how I am feeling, but it's affecting my function. Is that
Mhm.
what you're
That's
trying to say?
critical. Yeah.
Okay, so something is not right about my ability to function. If that comes to someone's awareness, they should seek help with a healthcare professional. So
Like if someone's grades start to drop or they start um, having a lot of conflict with their family out of nowhere, or they're not able to clean their home and go grocery shopping the way they typically can.
that's a great way to think about it. Thank you. So now let's fast forward a bit. A young adult now comes to you in your office and feels that their functioning is off, something about their life is off in the sense of grades or their ability to relate to friends and classmates, family, uh, or just how they're feeling. How do you go about evaluating this young adult, and how do you see if there is something that is off with adjustment or that it's a mental health condition?
Yeah. Well, I mean, so when I was saying you're looking for a cluster of symptoms, what I'm talking about is the diagnostic criteria for the DSM-5 more specifically. So I ask about the diagnostic criteria and see if they meet those criteria for a diagnosis. Some people may not because they don't have enough symptoms. They don't have the impairment in functioning that I was mentioning earlier. Or maybe these symptoms can be attributable to something else, such as an underlying medical condition. We do check basic labs, a number of basic labs, when someone comes in for their first evaluation, just to see if one of these common medical conditions could be the reason behind their mental health symptoms. Um, Examples of common underlying medical conditions that can cause symptoms that look like a mental health disorder are things like anemia, vitamin D deficiency, pregnancy. These are pretty common reasons why someone could have symptoms but not meet all the criteria for a diagnosis, a mental health diagnosis.
Right. So there's lots of things that a psychiatrist is looking at before making a diagnosis of depression. So if it's not one of these physical causes or medical causes of depression or anxiety, what are the criteria that you look for to make a diagnosis of depression?
Well, depression has a very specific list of diagnostic criteria. So there needs to be at least 5 of those listed symptoms being met. So that would need to include a change in mood, which could be something like depressed mood or irritability. Um, there needs to be changes in sleep, appetite, energy level, um, feelings of worthlessness or guilt. There's a number of symptoms, and if they meet 5 of those for most days than not of a 2-week period, as well as the impairment in functioning, then they would qualify for a diagnosis of major depressive disorder.
Okay. Let's talk about when a young adult has a first or new diagnosis of major depression. What are the options for treatment? How do you go about treating such an individual?
It depends on the assessment. If the symptoms are more on the mild side, we like to start with therapy. If they're more on the moderate to severe side, we like to combine therapy with medication. So it really just depends on the severity of symptoms.
So many times it's a combination of therapy plus medications.
Yeah, so that has been shown to work the best for moderate to severe symptoms versus either one of those treatments on their own solo.
Okay, so for somebody who has moderate depression and they're already getting therapy, what types of medications are available for use, and what should someone diagnosed with this know about the medications? What types of medications are available and how effective they are?
So for depression specifically, our go-to medication class are SSRIs, and they're very commonly used. So commonly prescribed in the US. People probably know someone on these medications if they're not on them themselves. So things like fluoxetine, which the brand name for this is Prozac, or sertraline, which is commonly known as Zoloft, or escitalopram, which the brand name for this is Lexapro. These names people have probably heard. So those are the most common medications we use, SSRIs for depression. They're well tolerated. Of course, there are risks of side effects, and it's hard to predict whether side effects will happen to any one individual or not. But the most common side effects would be things like headache, upset stomach or nausea, especially in the first week or so. Even in the first week, you could have things like increased anxiety or irritability, but generally those symptoms start to taper off as your body gets used to the higher levels of serotonin.
So a number of things to weigh as therapies, or sorry, as medications are considered. So one should be under the care of a healthcare professional.
Absolutely. This is not a decision to take lightly, what you do with your symptoms, how to treat it. You really want to speak to a doctor you trust. And I I even like to not only go over the side effects with patients, but I also like to give them resources that they can, like places online that I trust where they can read further about medications. Places like medlineplus.gov is a really good resource. That's the NIH website. And people can just search fluoxetine or sertraline or escitalopram and read further about what we talked about in the office and then bring back any questions that they have to me.
I want to turn now to the role of social media
Sure.
because we hear so much about social media these days. Of course, on the one side, it's beneficial. There's so much you can do in terms of connecting with other people, keeping up with the world, participating in discussions. However, there's also a side of social media that could adversely affect someone, especially a young adult. So I'm wondering if you can tell us what you've seen in terms of how social media can adversely affect a young adult.
So the US Surgeon General, his office recently came out with an advisory on social media and youth mental health in 2023. So this has been a topic of conversation in child and adolescent psychiatry, a big topic. We haven't seen this level of attention being drawn to this topic. So I think it's really cool that his office is looking at this and making it a priority, and not just in terms of bringing awareness to this, but also advocating for not just individuals to make change around this, but also the government and businesses to make changes, policy changes, to address this issue. So you were asking about what problems arise with youth who have maybe extensive exposure to social media. And in this advisory, he does list data about how 95% of youth in the age range of 13 to 17, so these are teenagers, use social media. And then around 2/3 of teens use it daily. And 1/3 of teens report using it, quote, almost constantly. So it is a major part of teenagers' lives, major, major. And we have seen, unfortunately, some negative aspects to the use. So I think we talked about cyberbullying already. And even outside of cyberbullying, there can be some pretty significant hits to self-esteem, and body image, just from exposure to like these aspirational depictions of life on social media. And then there's also just hate speech, which might not be, you know, on an interpersonal basis, but on like a more broad platform, perhaps, that kids get exposed to. In terms of behavior, social media has been seen to negatively impact sleep and sleep patterns. And obviously, sleep is so important in this time frame because these children's bodies are growing, their brains are developing. So sleep is super important during this time.
Yeah, given the potential negative effects of excessive use of social media, what do you advise your patients?
So I really recommend this be a family discussion because oftentimes, you can tell a a child, a teenager, um, you can give them recommendations, but if they're seeing a different habit being modeled to them by their parents, it might not be very effective. So it's really more of a conversation that needs to happen with the whole family. Oftentimes, parents, adults have their own unhealthy habits around social media and their phones. So one thing I recommend is there's a website called healthychildren.org, and they have a guide from the American Academy of Pediatrics, to help families create a family media plan. And this can be tailored to the individual family. It's not like a one size fits all thing. So, examples of things you can do with this guide or this media plan could be creating screen free zones or screen free times, or having a rule like a one screen at a time rule. So the other piece of this, like I was saying, it's important that every family member be involved and be a part of the plan. So everyone needs to take a look at their social media habits to make this as effective as possible for everyone. But I also want to say social media isn't going anywhere. So instead of kind of eliminating it altogether from your household, I think it's more important to teach your kids how to use it safely and appropriately and start initiating those healthy habits around the internet and social media. Social media isn't all bad. There are some benefits to using social media, such as connection to other people. Especially, this can be important for marginalized groups such as individuals with disabilities or the LGBTQ community.
Yes, it seems like we have to find a balance in how we use social media, and perhaps we reflect a lot of the others who use social media in our lives.
Right.
So, thank you so much for that. Let's turn now to a very difficult topic, suicide.
Yeah.
There's national data that shows that is perhaps the second largest cause of death in young adults after trauma. So, what are the steps that one can take to prevent suicide? Are there things that family and friends can do to recognize and help prevent suicide?
Yeah, that's a good question. I want to add to that. This suicide rate has been increasing every year. It's very alarming. It's really a crisis for our country. I think awareness that it could be an issue is like the first step, right? So maybe you're looking out for comments made by your loved one about feeling hopeless, feeling lonely, having thoughts about death, or even wanting to die. Looking, if they're especially like looking up ways to die or having changes in their usual behavior, like withdrawal from their usual social contacts or their usual activities and hobbies. If there's an increase in substance use or more moodiness, those are things that can help family members or loved ones kind of clue into maybe we need to do something here. So I would say there are online resources for this. 988 is the National Suicide Hotline. So you can always call them in this situation where you have questions or even an emergency. There's also the American Foundation for Suicide Prevention, which has really great resources for loved ones who are concerned about someone. And then there's also the Trevor Project, which is specific for the LGBTQ community. And then obviously they can go to a mental health clinic and set up an appointment for their loved one.
So the bottom line is increased awareness by family and the person who's feeling this, and seeking help both from family, friends, as well as healthcare professionals. And you mentioned national resources.
Yes.
Thank you so much for describing that for us. It's a very difficult topic, and more needs to be done, obviously, in prevention of suicide. Dr. Yamaguchi, you practice at UCR Health, correct?
Yes, I do. And I see mostly college students who can be from any university. They don't have to be from UC Riverside.
Great. You're a wonderful resource for our community.
Oh, thank you.
Thank you so much for joining us today. It was wonderful to hear your expertise and to learn so much about mental health.
Thank you for having me. It was a nice conversation.
Thank you so much.
Thank you for listening in to Beyond the Stethoscope. This podcast was brought to you by UCR Health, the clinical enterprise of UCR School of Medicine. UCR Health is comprised of a team of physicians, specialists, and healthcare professionals. With medical offices located throughout Southern California, UCR Health is growing to meet healthcare needs of the region, bringing innovative, compassionate medical care to the communities where we live, work, and play.